and malaria and tuberculosis and coincident cases because of the absence of healthcare systems out there to do the testing, to do the education, to do the prevention work, to distribute the medicine, to do the follow-up. And that's what I hope we'll talk about today, why we still need a World AIDS Day. And I'll just give you one example. We had 1 million people added to the treatment rolls now. We have more than 4 million people in poor countries throughout the world on treatment, half of them on contracts our foundation negotiated, including we have more than 200,000 children on pediatric medicine, which is more than 60% of all the kids in the world. But it's a tiny fraction of the children who need it, and it's still only barely over 40% of those in the world who need the medicine to stay alive. The rest of them are not getting their medicine, primarily because there are no delivery systems out there. So we need to talk about that, and we need to talk about how we've kind of let our attention slip here at home.
Thank you, sir. Wafa, you've dealt so widely internationally. Yesterday, WHO changed the guidelines on the initiation of treatment to begin it rather earlier, which means, I think, objectively, that there are probably something in the vicinity of over 10 million people who require treatment now, according to their guidelines, with only 4 million receiving it. There is tremendous anxiety in this country over what is described as the flatlining of the budget, of the administration's budget, and the seeming pullback in providing the resources that are necessary to both sustain and increase the treatment. As a matter of fact, if this isn't presumptuous or untoward, a group of quite thoughtful activist NGOs yesterday gave President Obama a D+, which is an unusual mark in this administration's history, for the response to AIDS. And there is a very strong feeling that the slowing down in funding is going to compromise people's lives. Can you comment on all of that?
Thank you very much, Stephen. I think if we step back and think about how we got to where we got, it was through tremendous mobilization. And clearly groups like have worked on this for years and years, including the President and the Clinton Foundation, ICAP, and many others, have tried to mobilize the resources to make a difference. And it really is tragic to reach a point now where we can make a difference. We're starting to see improvement in life expectancy in countries like Botswana, decrease in mortality in countries like South Africa, that we would not be able to reach the finish line, essentially, and to really vanquish HIV, both in terms of treatment and prevention. In reality, even without the change in the guidelines, the WHO guidelines, even without changing the guidelines, we still about have 2/3 of people who still need treatment today. So I think the bar is much higher, and comes at a difficult time, at a difficult economic time, at a time when people are making choices between the domestic epidemic, the global epidemic, the other health threats that are facing the world. And in a way, it's a moment where we're stepping back, and we've been discussing today, this morning, at a full-day symposium, how HIV can catalyze the transformation of health systems. How can we use the resources better? How can we build on the foundation of what PEPFAR has established, what other people have funded and established? How can we build on that so that we can actually capitalize on the foundation to be able to reach, to do much more? Nonetheless, without advocacy and without commitment of new funding, unfortunately there'll be people who are not going to get treatment, and unfortunately there'll be women who will not be treated, and there'll be children who are not going to be treated. So on World AIDS Day, we come together to re-energize all of us around the cause of maintaining, sustaining the commitment, the global commitment to HIV, the global commitment to the health of poor people around the world, and the global commitment to transforming the health systems around the world to systems that are humane, appropriate, high quality, and effective.
Wafa, do you buy the argument, which is more and more stated, that too much money has gone to AIDS at the expense of other areas of health, particularly maternal and child health, and that there should be an extraction of some of the AIDS money for the other alternatives, given the financial crisis?
Unfortunately, I find that that argument is not useful. It's often divisive, and it takes people who should be working on the same side, they put them into as enemies across the line rather than together. And I think the pie has to grow bigger. The commitment to health is very vital to commitment to development. And again, synergizing between HIV, child health, maternal health together in the context of strengthening health system can actually get us all to achieve what we want. So I think, again, it is not a useful argument, take away from HIV and put into something else. I think there are more potential for synergies and complementaries and growing together and solving problems together rather than pitting people who should be really battling the same battle together.
May I say to colleague panelists that if they want to jump in on any discussion, please do so. And I saw you smiling thoughtfully to yourself, Virginia. Did you want to comment on
No,
that?
I just simply was agreeing with the last comment that it really becomes very divisive when we talk about whether or not one approach or one disease should be considered over another, or if money should go in one area. The reality is we must remain focused, as the doctor said, on all of this. So that was the point of agreement for real.
Well, let me take you further into the domestic scene, which is clearly important in this discussion, and I will admit to being an appalling ignoramus in the context of exactly what is happening in the United States. But I get the sense, given that there were 53,000 additional, more than 53,000 new infections last year, and such a disproportionate number within the African American community, and particularly amongst women, and the situation we've now learned is extant in Washington. Can you make comment on all of that from your policy viewpoint that you pursued?
Well, I think it is true that last year when the Center for Disease Control released its report, it showed that there were far more new incidents of HIV than initially thought, 56,300. Among that population, we saw a disproportionate amount among people of color, African Americans, Black gay men, MSMs, men who have sex with men, and Black women. And I think that what it has shown is that we must make sure that we know exactly where the resources are going, and that the resources are going into the areas of greatest need. And preliminary work that has been done by the National Black Leadership Commission on AIDS, of where I sit as the president and CEO, we're finding that that is not the case. And the disproportionate numbers that we're seeing among Black women, but when we think historically, women of color and children have been heavily impacted by AIDS, HIV, since its inception. And Black women showed unusual signs of AIDS very early on, but they were misdiagnosed or classified as prostitutes or not diagnosed at all. And now, only since 1992, when the Center for Disease Control expanded its definition to include not only tuberculosis, pneumonia, but stage 3 of cervical cancer, did we begin to see major changes for women living with AIDS. So I'm sure that those numbers are also a part of what we're seeing now today. And as we look today, there are many issues that are impacting why perhaps we're seeing this disproportionate amount among especially Black women. It goes to traditional relationship structures, which I'm sure many in the audience can agree with and know about. Negotiating, the use of condoms. You know, these men will tell you things, baby, I'm okay, you know, you can trust me. And it's not always the case. We've got to push for safer sex, use of condoms, getting people tested, knowing our partners, reducing the number of partners. All of those things are a part of, I think, where we need to be going today so that we can reduce the disproportionate impact within the African American community generally and Black women specifically.
Khalid, you want to enter into this discussion?
Yes. You know, it's interesting that we're talking about, you know, how we've grown since the beginning of the epidemic, since 1992. I think what we've seen is that we've done a lot of work to expand access to HIV testing technologies, access to medication